Hello, and welcome to this Delsys webinar, Autonomous Gait Monitoring in Parkinson's Disease. My name is John Latisi.
And my name is Bhavna Shivani.
And we are research engineers at Delsys. We've designed this webinar to be easy for anyone to follow along, from doctors and professors to laymen and students. Those of you working with patients with movement disorders, including clinicians, researchers, and therapists, should find this presentation especially engaging and come away with a clear sense of how innovative technology can transform healthcare. We'll start by laying out some of the challenges associated with motor disorder symptom tracking today, and how the NIH motto, "Translating Technology into Health," can help us visualize the future of symptom tracking. We'll then go behind the scenes of our ongoing NIH-sponsored study and show how we use advanced wearable sensors to autonomously detect the fingerprint of abnormal gait in Parkinson's patients. Finally, we'll discuss how our unique solution to monitor quality of movement could be useful for not just Parkinson's disease, but also a wide range of movement disorders, injuries, and conditions. As I mentioned earlier, our study focuses on tracking motor symptoms in patients with Parkinson's disease, which is a chronic, progressive disorder that affects dopamine-producing cells in the brain. Symptoms include tremor, rigidity, postural instability, and bradykinesia, which is a general slowness of movement. Parkinson's disease presents a number of challenges, the first being its prevalence. Over 10 million people worldwide suffer from Parkinson's disease. Firm diagnosis is also difficult, as patients are required to perform a battery of scripted tasks, and visual symptoms can vary throughout the day. Treatment requires precise regimens of medication, which are adjusted depending on active symptoms and disease state. Symptom monitoring is crucial for effective treatment. So how are motor symptoms tracked today? Patients are usually asked to keep track of their own symptoms in daily diaries. About once a month, a clinician will observe patients as they perform a series of scripted movements, one limb at a time, and record any symptoms they may observe. However, clinicians only directly observe patients for about an hour, and symptoms can fluctuate throughout the day. Therefore, the vast majority of symptoms are self-described by the patients. The current state-of-the-art for symptom tracking has obvious limitations. Daily diaries are inconvenient and place a huge burden on the patient. Clinical sessions are infrequent, and self-described symptoms present an incomplete picture of a patient's disease state. The National Institutes of Health vision, Translating Technology into Health, aims to reduce the burden of neurological diseases like Parkinson's disease by partnering with advanced technology firms and developing solutions that ultimately lead to improved quality of life for millions of patients. Delsys, with funding from NIH, set out to overcome the current challenges in symptom tracking and deliver a solution that provides autonomous symptom tracking, enables continuous monitoring during functional activities, and captures a complete profile of symptoms. We envision a future where tracking motor disorder symptoms is as easy as placing a few small wireless sensors. Patients are free to live their lives, while clinicians automatically receive detailed reports on their patients. Continuous monitoring means medication and treatment regimens can be optimized quickly, leading to improved care and quality of life for patients. So how did we realize this vision? How did we assemble these different pieces into a complete solution? Our symptom tracking solution has two main components. First, our solution employs a human-centric approach. In other words, the patient always comes first. This means that it is simple and easy to use in daily life. It provides individualistic characteristics of symptoms. Everyone moves differently, and our solution remains adaptable. Finally, our symptom tracking tool is useful because it provides clinically relevant data measures. Clinicians are able to easily interpret reports and adjust treatment accordingly. Second, our solution uses a mobile biofeedback system to measure symptoms. This system employs mobile, wearable sensors so that patients can be monitored outside of the lab or clinic. The system is easy to set up and use and highly portable. Patients are able to place these sensors and start tracking symptoms almost instantly. Finally, and most importantly, these sensors are research grade. High-fidelity data are critical to characterize subtle differences in muscle activity and movement. For this study, we used Trino Avanti wearable sensors, which transmit high-fidelity EMG and movement data directly to a tablet or phone. I'll now pass you to my colleague Bhavna, who will discuss our current research study where we use our symptom tracking solution to monitor patients with Parkinson's disease.
Thank you, John. I will now take you through an ongoing research on monitoring the quality of gait in Parkinson's disease. Most studies that monitor the quality of gait often include technologies like instrumented treadmill, center of pressure force plate, and motion capture cameras. These technologies have demonstrated their efficacy in lab environments. However, there are no good solutions to capture such robust metrics out of the lab settings. With this ongoing research, we aim to extract robust gait metrics in the context of daily activities. Using two Trino Avanti sensors, we acquired triaxial inertial measurement and EMG data from extensor digitorum muscle in forearm and tibialis anterior muscle in the leg, and used that to focus on analyzing the muscle activation and movement outcome. Let's focus on these muscles one by one. For tibialis anterior, the EMG data was used to capture the muscle activation patterns during gait cycle. And then from IMU, we focused on gyroscope because of its value of angular velocity. Most of the movements in body are angular displacements rather than linear, which makes gyroscope a natural physiological tool for assessing and understanding movements of the body. Now let's see what these data tell us about gait. Features of gyroscope can tell us about different phases of gait, such as toe off and heel strike. Between those two, then I can measure the mid-swing. EMG data can tell us about the muscle activity in tibialis anterior that enables toe off and heel strike movements in the gait cycle. The second sensor is placed on the extensor digitorum muscle in the upper limb and captures the activation patterns of this muscle. It tells us about the hand movements using the EMG data during the gait cycle. The gyroscope data tell us about the angular velocity of arm movements during gait. To learn more about the arm swing metrics during gait cycle, we used the zero velocity points at peak forward and peak backward range of arm motion from the gyroscope data, while the arm is moving in backward direction. From this, we can extract the features like range of arm swing and maximum velocity. Combining this information with the muscle activation patterns of extensor digitorum, we get the complete picture of muscle activation and resultant movement activity. We will now dive into the details of how to compute different gait parameters from this data. Angular velocity of arm swing. Reduced arm swing is one of the early signs of Parkinson's disease. A healthy arm swing is sustained under the medication effect. However, as the effect of medication diminishes, arm swing starts getting reduced. On the left side, the peak angular velocity during healthy gait is presented in black, and on the right, the peak angular velocity during medication off phase is presented in blue. The difference in peak values demonstrates the reduced maximum angular velocity of arm swing in the medication off phase. Next metric is angular range of forward leg swing, which presents the joint displacement during gait in angles. As Parkinson's symptom manifest, step range starts getting smaller. The area under the forward leg swing indicates total joint rotation of lower leg in forward direction. This area is highlighted in the figure for a patient during medication on phase. After the medication wears off, this area gets reduced, indicating lesser joint displacement during gait. Angular range contrasts the step length, which varies with the height of subject. Using joint angle, we can capture this metric independent of the height of subject. Toe-off dynamics. Toe-off dynamics captures the foot-off and foot contact mechanics during gait. As Parkinson's disease symptoms dominate, gait movement start getting impoverished, which leads to minimal toe-off. Toe-off dynamics can be measured as the negative peak in angular velocity during gait cycle. The figure demonstrates negative peak attained before the forward swing during medication on phase. This peak height gets reduced in the medication off phase, indicating diminished toe-off, which is characteristic of a more flat-footed gait. Till now, we have only discussed movement-related metrics of gait. However, to get a complete picture of gait symptoms, it is crucial to study the muscle activities originating these movements. Association of muscle EMG with gait cycle during medication on and off phases can help us to analyze the muscle activation patterns between these phases. In figure presented on left side, we see the EMG RMS in association with respective gait cycle captured by gyroscope during medication on phase. In medication off phase, we see that not only the gait footprint captured by gyroscope changes, but its association with EMG RMS also demonstrates a change, indicating the increased rigidity of muscle. To understand these symptom fluctuations in depth, muscle activity exploration is crucial. I will now present a case study from our ongoing research in which we had to monitor few of the gait metrics that we just discussed before and after taking medication. During a walking instance detected before taking medication, the value of speed of leg swing, range of leg swing, and range of arm swing metrics were recorded. In the next walking instance detected after taking medication, a distinct improvement was observed in these metrics, showing an increased speed and range of leg swing and increased range of arm swing. This indicates that not only these metrics are sensitive to changes in disease symptoms, but also they are informed by underlying physiological symptoms of the gait. These metrics provide a valuable quantitative evidence of symptom fluctuations to inform the clinician's assessments. With this evidence, this tool can serve as an objective method of journal gait assessment to develop potential patient-centric therapeutic rehabilitation approaches. It can be used to actively verify results and the efficacy of treatment on patients' gait. This was one of the numerous examples that show that this technology has the potential of broad impact across a wide variety of research fields investigating human movement. It touches the areas of sports, exercise, medical research, orthotics, rehabilitation, and physiotherapy. Let's consider few of the examples below. Clinicians can use this technology to identify biomarkers of disorders related to movement, which will help them with a better informed prognosis, and it will also serve as a convenient setup of identifying early signs of illness. This technology can serve as an important tool for the therapists to evaluate orthotics intervention. It is also a great tool for companies that provide solutions in this area, for example, TJO, to help evaluate their solutions for rehabilitation, pain management, and physical therapy. With this technology, it is possible to assess the postural stability and fall prevention techniques in controlled environments. Stroke rehabilitation is another domain where movement and muscle activity feedback is much needed and is immensely helpful to patient, therapists, and the rehabilitation companies like Hokoma that provide solutions in this area. The most impactful contribution of this technology to biomedical researchers is the new methods for analyzing and understanding human movements. It can be used in postural stability or near fall analysis. Prosthetics and robotic rehabilitation is another area where movement and muscle activation feedback can be used. Delivering innovative technologies is one of the ways Delsys is working to advance the science, forward healthcare, and ultimately improving the quality of life.
We'll now answer some of the questions we received during the webinar registration process. If you have additional questions, please feel free to ask them through the WebEx chat and Q&A windows, and a Delsys engineer will get back to you via email in the coming days.
How can one use IMU and EMG for understanding asymmetries between limbs in Parkinson's disease? The methods of capturing objective data metrics explained earlier can be adapted to understand and compare symptom manifestations at many levels. By replicating the two sensor setup on other side of the body, we can then monitor these metrics from both left and right side and can perform a comparative study to understand asymmetries in Parkinson's disease.
What is the difference between only using accelerometer sensors versus inertial sensors to study kinematics? The basic difference is that accelerometers measure linear acceleration, which can vary depending on segment lengths and is affected by the orientation of the sensor with respect to gravity. As we show in this study, the gyroscope measures angular velocity, which is independent of the length of the limb and unaffected by gravity. This makes the gyroscope metrics more robust than the accelerometer metrics when dealing with multiple subjects of different builds.
How easily is the system integration translated to other disorders or body regions? I would be interested in using such technology to quantify post-operative patient activity levels and range of motion during daily activities. Translation of system integration to other body parts or disorders is highly simple. We have used this system to explore highly variable symptoms in Parkinson's disease, which include bradykinesia, dyskinesia, tremor, and postural instability. This technology can serve as an objective tool to quantify activity levels. One of our in-house research projects uses these sensors to detect different activities such as walking or sitting and quantify the activity levels with a high accuracy of 99.5%. Then, depending upon detected activity, we can compute the range of motion using the metrics from inertial measurement data. Thank you for attending this webinar. We will post a recording of the webinar on our website. If you have suggestions for future webinars that you would like to see, we'd love to hear them. Stay tuned for upcoming publications related to this work.